Right, my name's Tom Gattisher. I'm a GDP from Preston. I've just done my second batch of 2 days, so the fourth day of my 10-day dental implant course here. I've placed 10 implants in the last 2 days, which is great. We've done a combination of sort of guided surgery, surgery without guides, bone grafting, different flap designs. I've learnt a lot from Jag.
Thanks. Thank you, Tom.
That's all right.
So the course has one of the things that's quite important, I think, is to make sure that it delivers what is expected from it. And do you think the course has for you?
Well, the main reason I attended the course was to place implants, and I've placed a lot of implants, or I feel as though I've racked up quite a few numbers. Different types of implants, different positions, maxillary, mandibular, different lengths of implants. So I feel as though I've got a good sort of width of knowledge.
And what does this course offer that many other courses don't offer, in your opinion?
I think the emphasis on hands-on training, rather than sitting in a lecture theatre learning about things. And we've done the theory already. It's good to get involved and place lots of implants. Jag's really confident at showing us the anatomy as well, so knowing where the sinus is, identifying mental nerves, so it gives us a bit more confidence in how to place.
Tom, would you recommend this to your friends and colleagues?
Of course I would.
Thank you very much.
Goes without saying.
Thank you.
Hi, my name's James. I'm a dentist in Knutsford. I've just completed day 4 of my 10-day implant course, and I've placed around 10 implants in the last 2 days. The course has been really good. It's exceeded my expectations in terms of exposure to implant placement and bone grafting. We've placed a variety of implants in a variety of sites, and also had the opportunity to do a couple of freehand implants and a few guided implants as well. So it's been quite a good range of experience so far.
And how many implants have you placed?
Over the last 2 days, about 10, and I think in total here at Dental about 12 altogether.
Super. And one of the things that Tom mentioned was just familiarity and comfort with anatomy. So that's always been an emphasis, really, to demonstrate anatomy and make sure delegates are comfortable with anatomy for the maxilla and mandible, as well as demonstrating a variety of techniques, including closed techniques and guided techniques. Do you think we've achieved that?
Yeah, definitely. I think we've, over the last couple of sessions, when we've been working the mandible, we've identified the mental nerve and had the opportunity to see when that was coming out of the mandible, which is good. We've been talking a lot about the sinus and engaging the cut floor of the sinus to put the implant in place. And I've had a lot of experience of guided surgery as well with various guides. And
do you feel ready now to go back out into the big wide world and place implants yourself? Do you think we've given you the confidence to do that?
Yes, definitely. Yes.
Super. And finally, would you recommend this to your friends and colleagues?
Yeah, I would definitely. I think the range of practical experience that I've gained from this has definitely exceeded my expectations, so I'd recommend it to anyone.
Super. Thank you very much.
Brutally honest, or what do you want?
I think honesty is
best policy.
The best policy, personally. I think if there's positive feedback, brilliant. If there's negative feedback, we can always edit it out. But I think we're all human, and I think people want to see.
Would you rather have the negative feedback on paper?
I think you should give me whatever feedback you want to give me. Okay, I'm open to this. So, right.
Are you going to give us some feedback, by the way?
Yeah.
Hi, my name's Aslan. I'm principal dentist from my practice, and I joined the course because of the hands-on element, I was told. And I'm day 6 today, and the least I can say is I've had nothing but hands-on. We've placed, up until now, I've personally placed about 14 to 15 implants. I don't have the final number. And various skill sets, not just one approach. I've had an open, closed approach. We've used guides, we've done freehand, I've replaced failed implants, I've put in immediate implants. We've had a varied number of skills, set exposure, which has been second to none.
Super, thank you. And?
Hi guys, my name is Bilal. I'm also a principal dentist as well. Currently completing a master's in fixed removal prosthodontics, and which actually there's not many surgical placements, so we restore a lot of implants, but we don't place a lot of implants, and that was one of the reasons why I wanted to do this course. And to be honest, I have to agree with Aslam. It's been nothing but hands-on right from day one. I remember on day 1 we did a Summers lift, which was, the great thing about Jag as well is that he demystifies a lot of the treatments, and before I came here, I used to thought implants is all this, really scary thing that, all the big timers should be doing, etc. But he really makes it easy, so looking at the anatomy, looking at the mental nerve. We did an anterior placement today, which is quite a difficult case. Right from day one, we've had hands-on techniques, a lot of difficult stuff. It's been a wide variety of stuff. So we're on day 6 now, I think.
That's right.
In terms of implants, I think I've placed about 17, 18 implants. But again, it goes down to whatever you get on the day. Sometimes you do have some cancellations. But the lucky thing is, a lot of patients don't only have one implant, they have a couple of implants. So you can always share with your buddies anyway. So, yeah.
Super, thank you. The course obviously claims to be very hands-on, practical, and you've both commented on just how much experience you have had. If there's anything that we could do better, what do you think that would be?
Well, it's a tough question, that, Jack, because personally, when I came into this course, I had no exposure to implants per se, just seen them on YouTube, and our practice had a visiting implantologist. I've come in and I've placed 15 implants under mentorship by Jag, and it's been fantastic. Limitation to the course, more implants, more surgical days maybe, because it's been fantastic for me with my minimal implant exposure and surgical experience, and leaving every single day thinking, as Bilal mentioned, that the implants are for only the very experienced. You've demystified a lot of the myths, made it so much more approachable, and having the hands-on element and working as a group, discussing the cases, thinking about different options, and then finalising a option for a patient. All that discussion brings the whole picture together for placing an implant, planning an implant, and actually the surgical element. So it's been fantastic. It's very, very difficult to suggest how we could improve it, except for more implant exposure for me personally.
Super. So chaps, the important thing from my perspective is to determine very quickly the technical ability of the delegates, hand-eye coordination, economy movement and so forth, and then tailor that kind of a bespoke approach in training dental surgeons to place implants. And do you think I've managed to achieve that with your experience on this course?
Well, first and foremost, having the amount of exposure we've had, it's definitely been, you've held our hand at the beginning. Assessment on our surgical experience, I guess you can really comment on that, Jag, in terms of how we've coped, but it's been brilliant.
I mean, it's been nice to see how you've progressed from day one to, okay, it's only 6 days, but now I certainly feel that you have the skills to be able to place independently and comfortably. Do you both agree with that statement?
Yeah, I mean, I definitely feel, I'm sure Aslam does as well, a lot more comfortable. One of the things that I found tricky was just initially was the perfecting the suturing techniques, and just little nuggets which I found very useful, that Jag came over and showed us, sometimes made a few videos, etc. But those little tips is probably one of the best things about the course. So anybody can place, or eventually anybody can place an implant into a lot of bone, but it's about knowing what to do when the implants are difficult to place. It's about knowing what to do when you've got difficult flaps to raise, and how to design your flaps and little things like that. So in the early days we were starting off with a lot more simpler stuff, and we were treating implants and we're doing the implants in a lot more simpler basic ways or classic ways. And then as things have gone on, so for example today we did like a palatal roll approach, or we've modernised techniques a little bit more and
implemented them, which is the main thing. Having the theory is fantastic, and sitting with Jag in the morning to discuss our cases coming up for the day, but not only that, discussing it and then implementing it, and then being hands-on with it has been the best learning curve for me, and it's been motivational all the way through. Not once have I walked away thinking I can't do implants. I leave every day thinking I'm an implantologist. Now maybe that's a bit too confident, but Jag instills that confidence in us, keeps us motivated, and making sure that not only can we do an implant right under his tutelage, but we can also recognise when it's not going right and how to deal with that. And I think that's been the biggest learning curve for us from a theory as well as a practical point of view, and that's what Jag kind of helps us with when we're doing the course.
Super, thanks chaps. And just one final question, would you recommend us to your friends?
Already done it.
I think the next cohort is 3 of our friends.
Okay, super. Thank you very much for your time, chaps.
Cheers, no worries. Thanks, Jag.
It's in the course, what stage you're at in the course, and then how many implants you've placed. So,
I don't know how many implants I've placed. It's probably about
That's great news. If delegates are losing count of the number of implants they've placed a lot of implants.
Yeah. Hi, my name's Junaid. I've been doing the course with JAG since January of this year. I've just come to the end of our surgical training with JAG and probably placed about 18 to 20 implants.
Super. So you're just finishing day 6 of the course. You have the restorative phase to go. Tell us about the course. Do you think we managed to achieve what we set out to achieve with this course?
So basically my background is mainly restorative, so I mainly came on the course to achieve more surgical experience, which I hadn't had before. So yeah, I'd most definitely say the course has not just achieved but surpassed my expectations. Jag was very good at communicating complex issues, which we found throughout the course. Little nuggets of information was given throughout the course. The thing with surgical training mainly is because we come across a lot of pitfalls, and I think Jag is very good at communicating all those things to us.
Super. Thank you. And it's just about demystifying and making people feel they can operate safely, competently, comfortably with a surgical economy movement. Is there anything that you think we could have done better in the course?
To be honest with you, from a delegate's perspective, I don't think so. I think it was fairly good in terms of what we wanted to achieve from the course, but we placed a number of implants, more than I expected. I think in terms of the types of cases we dealt with, there was a vast variety, and we sort of learned from each other's cases as well, so that was really good.
You know, we gave you experience of immediate placements, delayed placements, Summers lift, bone grafting, big flaps, small flaps, and closed techniques, open techniques. So certainly you've had a good range of exposure. Final question, then, would you recommend us to your friends?
Oh, 100%. I think it's opened the doors for implant treatment in my practice, and I think anyone that does embark on this course, I think, is an important stepping stone, and a very good stepping stone if they are trying to embark in that field.
Super, thank you very much.